Diseases of the large intestines in dogs and cats, the perineal and perianal diseases. So discuss the anatomy, the physiology and diagnostics of the large intestine. Acute colitis, it can be parasitic, bacterial or fungal. The parasites can be Trichuris volbus and Trichomonas balgberni. The bacterial can be Clostridium perfringens. And the fungus can be Histoplasma. For chronic colitis, the first category is lymphocytic plasmacytic colitis. The second is eosinophilic colitis, and the third is granulomatous colitis. The other colon diseases are irritable bowel syndrome, also known as IBS. Next one is constipation and neoplasm. The diseases of the anorectum are the anal glands. They can have impaction or sacculitis. Perianal fistula, it can be immune-mediated or it can be common in German Shepherds. Prolapse and tumours. The surgeries are a cecum removal, such as typholectomy. The next disease surgery is coloplexy, colotomy, and colectomy. So the anatomy of the colon, it has the ascending colon, the transverse colon, and the descending colon. There are no villi in the large intestine. For the physiology, the large intestine is responsible for the final conservation of H2O and sodium and chloride, the storage of waste products, and the microbiome population and mucus production. For the diagnostics, look at the history and do the physical examination. See if there's any irregular colon mucosa in the feces. For the laboratory diagnostics, look at the hematology, the biochemistry, and the urine. In regards to the feces, you can do a flotation test, do a direct smear, cytology, and culture. The cytology and culture are to see cytology is for histoplasma, culture is for Campylobacter and Salmonella, and flotation is for Giardia, and same with direct smears for Giardia as well. Acute colitis, it involves large bowel diarrhea. It's usually self-limiting. The causes can be diet, infectious, such as bacteria, toxins, fungi, or parasites, but it's you're rarely able to identify the cause. The treatment is diet, fast for 24 hours, and have a low-fat, hypoallergenic, highly digestible diet, and supplement fiber as well. This helps to normalize motility, bind colonic irritants, and it protects colonic mucosa. The causes of acute colitis are parasitic, bacterial, and fungal. The parasitics are Trichuris volbus and Trichomonas balgberni. For bacterial, it's Salmonella and Campylobacter and Clostridium perfringens, which is the most common. And for fungal, it's Histoplasma. For parasitic colitis, Trichuris volbus is one of the most common causes. It's also known as the whipworm. It causes intermittent large bowel disease. For the diagnosis, you can see eggs in the feces and parasites by colonoscopy. The drugs are fenbendazole. You give a high dose at 50 mg per kilograms 3 to 5 times a day for 3 weeks, and you repeat. For Trichomonas balgberni, this is a protozoan. You can see motile trophozoites in a fecal smear. They are found in the distal ileum and the colon, and they have adhesion to colon mucous membranes, which causes cytotoxin production, and it interacts with the flora of the colon. The predisposed animals are young cats, especially Bengals. It results in cowpad-like sticky feces, and within 2 years it's self-limiting, but there can be asymptomatic carriers in older cats. The best option is PCR, and the treatment is ronidazole, but it's used as an off-label drug because it's neurotoxic, therefore it's questionable. For bacterial colitis, it's a part of the normal bacterial flora. It normally doesn't cause a problem. It's mostly acute in the small and large intestines, especially in the case of Clostridium. The main bacteria are Clostridium perfringens, Salmonella, and Campylobacter. The main one is Clostridium perfringens, its most frequent cause of colitis. The other name is antibiotic responsive colitis, or Clostridium colitis. The predisposing factors are diet, antibiotics, and concurrent infections. The symptoms are mild, fatal, acute hemorrhagic gastroenteritis. And the diagnosis, it's difficult. There's no correlation between the severity of the diarrhea and the number of spores. And the treatment is tylosin, or amoxicillin can be given as well. For chronic colitis, there are 3 forms: lymphocytic plasmacytic colitis, eosinophilic chronic colitis, and granulomatosis colitis. Chronic colitis is when the colon experiences infiltration by inflammatory cells. The symptoms are it's chronic, it at least happens for 3 weeks, and it happens in middle-aged animals around 6 years old in cats and dogs. So lymphocytic plasmacytic colitis, it's the most common form of chronic colitis. It happens in middle-aged or older animals. The clinical signs are it can be cyclical, tenesmus, mucoid feces, and hematochezia. On a colonoscopy, you can see increased mucosal friability and granularity and a loss of mucosal vascularity. In eosinophilic colitis, everything's the same, but it's more severe. It always consider the allergenic manifestation to dietary or parasitic antigens. On a colonoscopy, it's more friable and there's more ulcerated than a lymphocytic plasmacytic colitis. In granulomatous colitis, it was formerly known as histocytic ulcerative colitis. Boxers are predisposed to this condition, and the clinical signs are severe large bowel disease, lethargy, anorexia, weight loss, and bloody mucoid diarrhea. It is similar to Crohn's disease. In the lab diagnostics, we can see anemia and hypoalbuminemia. The cause is adherent invasive E. coli. This is when the immune system is not able to eliminate the E. coli. In a colonoscopy, you can see reddish mucous membranes, it's friable, thickened, and there's erosions and ulcers and granulomas. And the treatment is enrofloxacin at a very high dose for a very long time, so 10 mg per kilogram for 8 weeks. The prognosis is good, but there's resistant in around 40% of cases. So, in overall, the treatment of colitis for dietary, it's a novel protein source, such as hypoallergenic, highly digestible food, and high fiber. You can also give NSAIDs, but not in the case of cats. You can give 5-aminosalicylic acid. However, the side effects can be keratoconjunctivitis. Mesalazine is the NSAID with the least amount of side effects. Anti-inflammatories or immunosuppressants can be given when NSAIDs are not enough, such as prednisolone and methylprednisolone. And antibiotics can be effective against anaerobes, such as tylosin and metronidazole. Other diseases of the colon are irritable bowel syndrome, constipation, and neoplasm. Irritable bowel syndrome is a non-inflammatory large bowel disease. It responds well to fiber. It can manifest in the forms of diarrhea, constipation, or mixed. The diagnosis is done by exclusion of dietary, parasitics, and infectious, and IBD. The treatment is to correct the abnormal motility, such as giving dietary fiber and anxiolytics in the case of when it's stress-induced. Such anxiolytics are chlorodiazepoxide. Constipation is an infrequent and difficult evacuation of feces and decreased intestinal motility. Obstipation is the intractable or stubborn or difficult constipation and the accumulation of feces. The occurrence is typically in middle-aged or older cats and dogs. The etiology, so when it's dietary, it's from excess fiber, bones, and hair accumulation. Or inactivity, obesity, drugs such as opioids and endocrine diseases. Or colonic obstruction, such as an enlarged prostate, pelvic fracture, or tumours, or perineal hernia. At the very end stage, we can see megacolon and lumbosacral spinal cord disease. The clinical signs are tenesmus and easily palpable masses of feces. For the diagnosis, you can look at the history, clinical signs, and radiography. For the treatment, perform a water enema and removing the feces, laxatives such as lactulose, which is given orally, and fiber supplementation, and prokinetics. In colonic neoplasm, so in dogs, adenocarcinomas, this is when they do not respond to chemotherapy, and it's common in German Shepherds and Shar-Peis. They can also get lymphosarcomas, and cats can also get adenocarcinomas, lymphosarcomas, and mast cell tumors. So diseases of the anorectum. So for the anal sacs, they can have impactation and sacculitis or even abscesses, perianal fistulas, neoplasm, and anal prolapses in the case of parvo. So the anal sacs and paraanal sacs. So invaginations of the inner cutaneous zone. So they are combined with secretions from glands and desquamated epithelial cells, and this combined with oily fluid becomes impacted and can lead to infection and even abscesses. In the case of sacculitis, the primary cause can be bacterial inflammation. A secondary cause can be from constipation, obstipation, and tenesmus. and these can lead to a dilation of the anal sacs. The diagnosis is easy. Look at the local signs. Is there increased amount of content and expressibility? Is there any local irritations or abscesses? For the therapy, conservative treatment is best. Express the anal glands and use a broad spectrum of antibiotics and wait 10 days. Disinfect with chlorhexidine and evacuate, and flush with antibiotic solutions several times. The perianal glands are androgen-sensitive glands, and they grow throughout the male dog's life. Androgen exposure leads to adenoma formation. For a perianal fistula, it can be immune-mediated, so an autoimmune inflammation, and it's concurrent with chronic colitis. It's found in 80% of German Shepherds when they're middle-aged from 4 to 9 years old. It does not occur in cats.